Thank you for tuning in to Global Elite Consultant and Global Elite Academy. Hi, my name is Dr. Patricia. Now, I'm going to give you the information as to how to, or what the programs are called in Texas that are similar to IHSS in Colorado and in California. IHSS is the in-home support service where patients can stay in their home and receive care instead of going into a facility. The Texas program that is similar to IHSS is Texas Health and Human Services Primary Home Care. It provides non-medical personal care such as bathing, dressing, grooming, meal preparation, light housekeeping, and medication reminder. The next program is Community Attendance Service. It offers similar in-home support services for eligible individuals of all ages with disability. Then you have the Star Plus program. This is Texas' largest Medicaid long-term care program for adults ages 65 and adults with disability. It includes personal attendance service, respite service, nursing service, home modification, and consumer direct services. Another program is Consumers Direct Services. It allows the Medicaid recipient to hire and direct their own caregiver, including certain family members, excluding spouses in most cases. Which program is most similar to IHSS? The closest equivalent is the primary home care, the community attendance service, the Star Plus with consumer direct service. These programs provide the same type of non-medical assistance that IHSS provides in Colorado and California. Can a home care agency provide these services? Yes, if your agency obtains a Texas Home and Community Support Service Agency license with the personal attendant services. You can contract with Medicaid Management Care Organization and state programs to provide attendant service to eligible clients. The basic steps to participate. You have to obtain your IHSS license. Basically, it's your nursing license. Then you need to enroll not your nursing license. Your home care license to run your agency. That's what you need to have. You cannot have this program if you don't have an agency. Then you need to enroll as a Texas Medicaid provider. Then you need to contract with Star Plus Managed Care Organization. You need to set up EVV, which is Electric Visit Verification. That's when the caregivers sign electronic in and out. Meet all Medicaid credential requirements. The managed care organization to contact with examples include United Healthcare, Superior Health Plan, Aetna Better Health, Consumer First Health Plans. Official Texas resources was the Texas IHSS licensing information. That's to get your license for your agency. Star Plus program information and the Tulip licensing portal. Okay. Okay, so that's what you would need to apply for community-based programs, or this one specifically, the IHSS programs. And so this will get you started. I usually don't, I'm only giving you enough so that you can read to see if this is something you want to do. You may not want to do it. And if you want to do it, then you can research yourself to get more information on, what do you do? I have so many people that come to me and they don't even research things. Somebody had moved here from out of town, and they wanted to apply for a nursing home agency license here in Colorado. So we set them up, get the license and everything, and they ask you, what county do you want to service? The people didn't even know what county. They expected us to tell them their county. Now I can make examples to you about what county, but I have no idea where you're going to live, where you're going to have your office, and where you want to run your business. Even if you're moving somewhere new and you don't know, at least you need to read up on it so you will have a clear idea of the counties. And then we could give you the county, we can suggest some counties. I went on to suggest some counties, but they didn't want those. They wanted their own counties. And then when they got those, they ended up sending it back because they couldn't get those. So listen, you need to do research. You come to consultants. We're not the one opening up the business. You're the one. So we assume that you have did some form of research about your business before coming to us. And then we can help you, like if you're moving somewhere new and you don't know the counties, and you say, well, I don't know the counties, can you please, tell me give me some suggestions? I would be happy to do that. But most people just be in the dark. They don't have a clue what county to try. They ain't even looked at the counties, child. They don't even know what the name of the counties is. This is your business, and you need to research it before getting into it. I always ask people, especially when they come into home care and they don't even have a clue. And they'll say, well, they got into it because it was the easy business to get into. And then when they get into it, they realize that it's not as easy as they thought. I mean, is that why you get into a business? Because the business is easy to get into? You need to do some type of research to make sure this is the business you're going to want to do. You might not even like working with the public. You don't know. You have to research. That's the main thing I want to tell people. Research, find out what you want to do. If this is something you're going to want to do, you're going to like doing, number one. And number two, don't just come in this business and you have no money for marketing. That's number two. You need to save your money for marketing. If you don't have money for nothing else, make sure you have it for marketing. Because you may get a few people from case managers, and you might get a few people from word of mouth. But if you really want to grow your business, who knows is there if you don't advertise it? Why go out and buy all this lavish stuff for your office, decorating, getting beautiful offices, and you don't even have the patience to pay for it? Don't this sound ridiculous? But that's what people do when they're trying to get into business, because they don't have a clue what they're doing. Or either I have to tell people, I don't know how many times, the same thing over and over, because you can't market to the case managers. So I have to tell people over and over, don't market to the case managers. They'll turn right around and say, oh, I'm going to send the case manager. I'm going to send all the case managers telling them I'm in business. Didn't I just tell you can't market to case managers? But what'll happen, because if you market to the case managers, they could pull your license and shut you down. or stop referring any patients to you. And I be done told to people over and over and over. And the thing is it's not my business. So I don't want to be aggressive to say, stop doing that. You know what I mean? Because this is your business. But people, sometimes you talk to them, will go one ear, come out the other. Go in one ear, come out the other. One lady, I told her she was making the ads too long, too lengthy. Nobody is reading all these ads. They just want to get a job. They want to see how much you pay and what I got to do. They ain't trying to get the history of your business. This is what I want to tell everybody. Just because you run an ad don't mean that the people are going to call you. Just because you run an ad don't mean you can convert that ad into selling. Remember that. When you make these long, drawn-out ads, nobody is reading those. And half the time, they're not going to even call you. The ad is too long and drawn out. When you run an ad, it is very important to get say what's important to convert. That is what you want to do, convert the calls. You don't want to talk about your history. I got this business because my grandmother told me to years ago. My grandmother, you know what I'm saying? Nobody want to hear that. Nobody care. And another thing when you're going into business, you'll say, well, I can't afford to pay you when you're hiring people. You say, well, I can't afford to pay you a lot because I'm just getting the business. Just starting my business. Nobody cares if you're just starting your business. If you're just starting your business, you needed to start it with more money because nobody cares. If you're hiring me for a job, I'm getting paid for that job. If you can't pay me, I'm going to another agency. But I ain't trying to hear your sad lullaby stories that you just got into business and when you get clients, you will pay me later. Ain't nobody trying to hear that. Don't nobody care. You shouldn't have got in business until you had got your money together. That's what people think. If I work for you, lady or gentleman, you're going to pay me. You realize I have to tell people that over and over again. They'll say, oh, I wish I could pay them more. I'm going to tell them. I'm going to pay them more when I get more clients. Honey, the people just withdraw from the job. They don't even say that when they're interviewing. When they're interviewing, they'll say, oh, yes, I understand. And then when you go back to, hire them for the job, they didn't withdraw. Why? Because nobody cares. Everybody have a story nowadays. You should not have opened up the business if you didn't have the money to pay the people. You think people going to tell you, oh, okay, I'm going to work for you for cheap until you get clients. Don't that just sound ridiculous? But I actually get people to do that. I can't believe it sometimes. I just want to pull my hair out. When you go into a business, get your money together. Get yourself together. Nobody want to hear your sad stories. So those are just little tips that I wanted to tell you all about, business. Have a wonderful week.